Well, Riley Hospital for Children at IU Health is now home to the largest newborn intensive care unit in the state. The Indianapolis hospital opened its new maternity tower just days ago. Business of Health reporter Kylie Veleta has more. Kylie.
Thank you, Gary. IU Health Methodist Hospital relocated its labor and delivery department and NICU and moved mothers and their babies to Riley Hospital in the new maternity tower. The health system says it's the start of a new chapter in downtown Indy because mothers and babies can now be cared for under the same roof, even the most complex cases. And joining me now to tell us more about the new maternity tower is Peri, president of Riley Children's Health. Hi, Gil. Welcome to the show.
Kylie, thank you for having me.
All right, this new maternity tower is 116 beds. Also, as we said, the biggest NICU in the state now. Talk about a key focus of keeping the mothers and the babies together.
Yeah, IU Health really identified the opportunity to put together a one-stop service where moms and babies could stay together throughout the whole continuum of care. The idea of keeping mom and baby together is important because we know that families heal together. And so traditionally, Methodist had the birthing center in a very high-level NICU, and now Riley Children's, the maternity tower, will have a one-stop service for all moms and babies, regardless of what their needs might be. So everything from the healthy baby all the way to the most complex will be able to be taken care of all under one roof.
And I understand the Methodist NICU, for instance, didn't have surgical for complex cases, so now all of that in one place. I think people typically associate Riley with babies and children. They don't also think about adult patients. So can you explain how this tower will also be able to care for the mother?
Yeah, at Riley Children's Health, we focus on the child, but we know that the health of the child starts during the pregnancy. And our ability to impact the pregnancy positively early on is really important for the child's health. And so at Riley, at the maternity tower, we will now have all the expertise that a healthy pregnancy, all the way to the most complex, might need, all under one roof. So everything that mom needs will be here at Riley Children's Health related to her pregnancy. We'll have an OB emergency department. So during the pregnancy period, if there's any needs related to mom, she could come to the Riley Maternity Tower OB emergency department, as well as labor and delivery, maternal fetal medicine experts, including interventionalists who can intervene early if necessary, as well as an OB ICU that's dedicated to mom should she get to the situation where she might need intensive care. So everything from the healthy mom and healthy baby all the way to the most complex will be able to take care of here.
And another big focus for this project is Indiana's high infant mortality rate. Explain how Riley is hoping this new tower can really help impact that, maybe move the needle on Indiana's infant mortality rate.
Yeah, we are so proud of the tower that we've been able to put together. It's state-of-the-art, has all the technology and space and expertise that a mom and baby and family need. We're most passionate about making an impact on infant and maternal mortality. For infant mortality as a state, we have improved in the state of Indiana, but we have a ways to go. There are some zip codes and neighborhoods that don't fare as well as others throughout the state of Indiana. Just like most states, we have to really focus on identifying what are the social and healthcare barriers to really helping them improve their infant mortality. We're going to do this as a community. Riley Children's will partner with the Department of Health and other providers throughout the state that can help impact infant mortality. And so we have a whole focus on making sure we at IU Health and Riley make a difference as the state. Maternal mortality has not had as significant of an improvement in the state of Indiana. We know that 1/3 of the counties throughout the state of Indiana do not have OB wards or labor and delivery centers. And so they also oftentimes have similar barriers to care, access to care or preventive services. So we know that we have some gaps to close as a state, and Riley Children's as well as IU Health will work collectively with our partners to help close those gaps. We know that there is a lot of focus on this. The Department of Health actually just yesterday hosted a Labor of Love Summit where everybody in that summit was really focused on what can they do for mother and baby. And so we're very confident that together as a community we can make a difference.
Really hope create some momentum there. You also focus on the experience for the mom and the baby in this new tower. Can you talk a little bit about some of those features?
Yes, the tower was very thoughtfully designed, including input from moms and families to really determine what did they need throughout the care that they received at Riley. And so we have a very comfortable environment. It very much looks like a hotel. As a matter of fact, one of our first mothers said that she was getting ready to get discharged in a couple days, but she wanted to stay a couple months. And so we created an environment where it felt very comfortable for moms. All of the private rooms are going to be available for parents and for patients to have the privacy that they need to heal and to engage with our expert care team. We also have the wraparound services that are really important to create a good experience. We actually created a space where there is a salon, a hydrotherapy massage table, and there's a lot of different things that we're going to bring to mom and family to enable them to be comfortable while they're at the Riley Maternity Tower.
All right, well, congratulations on completing the project, Gil. Thanks for being on the show today.
Thank you very much, Kylie.
And Gary, back to you.